Hi everyone, thank you for that introduction. So today we're going to be talking about fight or flight and adrenal dysregulation in our children with autism. So for disclosure, I will be speaking on behalf of the Ion Cleanse by AMD today, and so I'll be covering that later on in the lecture. So overview, what we're going to be talking about today is something known as the HPA axis. This is the hypothalamus pituitary adrenal axis. With that, we'll be speaking about cortisol and how cortisol may affect different systems in the body, as well as adrenal dysfunction, specifically in autism, testing and treatment, what we can do about adrenal dysregulation in our kids, and then about the Ion Cleanse. So first, the HPA axis. So this involves the hypothalamus that's going to release a hormone known as corticotropin releasing hormone. This will then stimulate the pituitary gland to release something known as ACTH that then can go to the adrenal gland in order to produce the catecholamine response with epinephrine and norepinephrine, as well as cortisol. So the purpose of the HPA axis is to essentially allow our body to respond to stressors in such a way that we can properly mount the response but then come back to homeostasis. The best way to look for HPA axis regulation and testing in a clinical setting is looking at cortisol, which I'll be concentrating a lot on today. So this is the pituitary gland. As you can see, the pituitary gland, it has a lot of functions. It is known as the master gland in the body, and that reason is that it can secrete 9 different hormones. 7 come out of the anterior pituitary, while 2 are excreted out of the posterior pituitary. And it's known as the master gland because it's one of the only endocrine glands that can act on other endocrine glands, meaning that it can release a hormone that will then stimulate something like the thyroid gland, which is an endocrine gland, as well as the adrenal gland. So it has a very important role. And then the adrenal gland itself. So the adrenal glands, they look like little jelly beans, and they sit on top of both of our kidneys. And they have 2 different areas. The outer layer is known as the cortex, and this has different layers that essentially, the one layer will secrete glucocorticoids, and this is cortisol. Another layer will secrete androgens, and this is some of our sex hormones, so estrogen, testosterone, DHEA, progesterone, and then also will secrete mineralocorticoids, so progesterone, and this will secrete aldosterone, which is involved in blood pressure, as well as salt regulation. And then the inner layer of the adrenal glands, this secretes catecholamines, so this will be our norepinephrine and our epinephrine that are responsible for that fight or flight response. So this is the regulation. Essentially what we see here is that the hypothalamus is going to secrete the corticotropin releasing hormone that then stimulates the pituitary gland. That pituitary gland will release the ACTH that notifies the adrenal medulla that, hey, there's something stressful going on, and therefore we need to release the catecholamines, that norepi and epinephrine. And as a result, we're going to have that fight or flight response. So what will happen in the fight or flight response? Our heart rate might increase, our blood pressure will go up, our glucose stores will be released, as well as blood flow is going to go to that skeletal muscles. And these are some of the physiological components that are going to happen during the fight or flight response. So this also looks at the adrenal pathway in regards to hormones. So it's kind of a busy slide here, but what I would like for you to pay attention to is that cholesterol that's at the top over there. So the cholesterol is extremely important in order to make most of our hormones, and including cortisol as well as neurotransmitters and our sex hormones. So cholesterol, we know that this is low in a percentage of our population. About 20% of children on the ASD spectrum have low cholesterol. So I'm classifying low cholesterol as anything really under 160. In the literature, when they say that 20% is low, they're really looking at under 100. But we would like to see that cholesterol level at about 160, if not above that. And so cholesterol will help to make these hormones. And then also you can see that it's important for vitamin D synthesis as well. And vitamin D is another hormone that's low in our children as well. So with my kids who I see very low vitamin D levels and I'm supplementing and I'm not making progress and not budging those numbers, I then make sure to look at the cholesterol levels as well to make sure that that it's in a good level and I don't need to support that because maybe that's the underlying cause for the low vitamin D. But essentially we want to make sure that we have good cholesterol in order to properly make our cortisol as well as the aldosterone and our androgens. So I really like this picture. I think it's pretty cute. Essentially what you see here is these little adrenal glands that are really stressed out and tired. And the reason for that is because there can be many different factors, including lifestyle factors, as well as physiological factors that could be impacting their health. So for instance, lifestyle, lack of sleep, which a lot of our kids have issues with sleep, can cause a stress, lack of exercise or movement, poor eating habits, dietary interventions, so a lot of sugar or white products, wheat products, caffeine, coffee, but then the environmental exposures as well, so toxins, allergies, chronic or acute infections can affect the adrenal glands, prescription drugs can affect them, but then also lifestyle stressors in general. So cortisol. Cortisol is the main hormone produced by the adrenal glands that we saw in the cortex. It is a stress hormone, and it's going to play a role in the following. So the ability to deal with stress and handle stress, metabolism, so specifically with carbs, fats, and protein. It's related to inflammation, blood sugar levels, blood pressure, and also the sleep-wake cycles. So this is a typical normal cortisol pattern where you have this normal diurnal rhythm where it's high in the morning and then throughout the day it should be decreasing for its lowest being in the evening. Our highest level of cortisol should be within 30 minutes of waking, and this is essentially our cortisol awakening response. So a lot of times this is what we're looking for, but this isn't always the picture that we end up seeing, right? So we'll talk about testing. But this is an abnormal cortisol pattern, so this is essentially the opposite of what we would like to see, where we have low levels in the morning. So these people are probably really sluggish to get out of bed. Their energy is not great. They're probably really, really grumpy. And then throughout the day, you might see a heightening in their anxiety levels to a worsening at night, where they're super anxious, have a hard time falling asleep, and if they are able to fall asleep, they're going to wake up throughout the night most likely. So this specifically looked at 4 points throughout the day, which you can do by collecting saliva, and then you can plot a graph, and I'll plot a graph like this for my kiddos that I get that test on so that parents can see. And so fight or flight. Essentially, the purpose of fight or flight is to help the body respond to a stressor, but then also to come back down into homeostasis. So what is homeostasis? Homeostasis is the dynamic state of equilibrium for optimal physiological functioning. When there are threats to homeostasis, there's going to be acute changes from the adrenal glands, and it's going to release this epinephrine. And that's then going to cause the sympathetic nervous system to respond. And that's going to be that fight or flight. And eventually, it will come back down after it's dealt with that stressor. And as a result, it's going to restore that homeostasis. So this is the general adaptation syndrome. This was Hans Selye, he came up with this. He essentially gave attention to essentially stress and said that it was a scientific medical condition and that stress was any demand that the body had on it. And he came up with this 3-part system that allows the body to cope with stressors. So the first essentially the first step is the alarm stage. So this is your fight or flight response. This is that initial, stressor that occurs. The body's going to be alerted. The adrenal glands are going to secrete that epinephrine, and you're going to be in that sympathetic mode. Then the second step is adaptation, and this is where the body becomes resistant somewhat to the stressor, and it's dealing with the stress. Even though it's still there, they're able to function. But then the last step is going to be that exhaustion phase. And that's going to be when the reserves, everything we got, has somewhat been depleted. And this is really where you see, in his models, it was animal models, and it was death of the animal. But essentially here, with what we see with ourselves and also with our kids, more of when possibly chronic illness comes into play. And so I wanted to provide some research that has been done in regards to adrenal dysfunction with ASD. And this one in particular looked at a group out of about 80 different kids, 40 that were on the spectrum, 40 that were neurotypical. And what they did was they measured saliva, cortisol saliva, 20 minutes before play and 20 minutes after play. And what they found was that the children with ASD, that after play, that it was a benign play encounter with other children, essentially, that their cortisol levels were elevated in comparison to the neurotypical kids. They also had parents fill out forms in regards to sensory issues, and they found out that after the encounters, the responses to the sensory sensitivities were extremely elevated in those children as well, compared to neurotypical children. So we have increased cortisol as that could be contributing to sensory issues as well. Here, this one looked at different ages in association with cortisol. And what they found was that older children with ASD had higher cortisol levels compared to the younger children in response to a benign social encounter. So you can see that with our older teenagers. They constantly seem to be in that fight or flight response, and they just have more of that cortisol being excreted, and that's what this study showed. Here, this is another study that looked at cortisol levels in the saliva before play, so unsolicited play, but then also solicited play with other children. And they looked at before and after. And what they found was that children on the spectrum, they had higher cortisol levels after solicited play with other children. But if it was unsolicited play and they were playing by themselves, they had the same level as cortisol as a neurotypical child. So it was really based off of that social encounter. And they found that the ones that had the higher levels of cortisol, that they had less social motivation and less communication, social communication. Here, we are looking at comparing the age effects of children with ASD. So what they did was they took measurements over a 3-day course at 4 different points throughout the day, and then they compared it towards neurotypical kids. What they had found was that children on the spectrum, that they had higher cortisol levels in the evening, but also what they found was that possibly that children on the spectrum, they didn't make more cortisol than a neurotypical child. They just seemed to have this cumulative effect of cortisol that ended up building out throughout the day so that it was higher in the evening. And here, this kind of goes with what I was had already mentioned, but children with ASD had lower morning levels of cortisol, which is, we would like to see high levels of cortisol. And then in the evening, they had higher levels of cortisol in comparison to the neurotypical children. But they also looked at stress as well here in regards to a mock MRI. And what they found was that children with ASD, they did not secrete more cortisol in comparison to a neurotypical child in regards to having to go through a mock MRI. But what they found was that when they brought that child back to that office, that they then had more cortisol in regards to anticipatory stress. So I can definitely say that this is true in my office when we draw blood. Usually the children are pretty good the first time around, but they do not forget where they are. They do not forget that room, and it can be very difficult to move, to get them to do a second blood draw in our location. So cortisol in general, how does it affect health? So we'll start with sleep. So cortisol levels have been associated, high cortisol levels have been associated with insomnia. They have been associated with nighttime waking, and also have been found in children and people with obstructive sleep apnea. And elevated cortisol will decrease the amount of quality REM sleep. So REM sleep is really important. This helps with social emotional signaling and allows for people to better be able to respond to body gestures as well as eye contact. We are actually, humans have more REM sleep than any other mammal. So that's very interesting. So I think it's important, that REM sleep component, and there's been plenty of studies that have shown that children with ASD have less amount of REM sleep or the quality is not as great. And then with the immune system. So cortisol has been associated with increased pro-inflammatory cytokines. So specifically with IL-6 as well as TNF-alpha. And what happens in response to an increase in these pro-inflammatory cytokines is we're going to have more inflammation. There's going to be a dysregulation of the immune system with a decrease in white blood cells and lymphocytes, and also an activation of latent viruses. So the best example of this is shingles virus, right? That stress can bring out shingles. And also lower secretory IgA. So secretory IgA, this is a component of the immune system in the gut. We measure this in the office through doing a CDSA. What we find with the low levels of secretory IgA, I don't know if any of you've seen this or have this study, is Saccharomyces boulardii can be really helpful. That's a prebiotic that's helpful for the immune system, but we've seen that that's helpful for bringing that up. Also, prolonged elevated cortisol can increase the risk for chronic infection. And I really think that kind of goes into the space of that exhaustion phase that I was talking about with the general adaptation syndrome. That when you have prolonged elevated cortisol, you're eventually going to exhaust all your reserves, and eventually there's going to be some chronic illness that's going to result from that. And then the thyroid. So cortisol does affect the thyroid. Elevated levels will decrease TSH. And also, it will decrease the ability for the proper conversion of T4 to T3. So that conversion is necessary in order for the thyroid hormone to become active. It will, instead, it will increase the conversion from T4 to reverse T3. So it's also important when you're doing a workup that you make sure that you look at all of those levels in the thyroid as well. So a TSH, a free T4, free T3, and a reverse T3 as well, because this could give you some information metabolically about what's going on, but also some clues about cortisol and the HPA axis. There's also been a relationship between dysregulated cortisol with subclinical or clinical hypothyroidism. So that kind of goes along with this whole entire picture. And then the mitochondria. So we know the mitochondria are so important for our kids, that about 60% of our children on the spectrum have some form of mitochondrial dysfunction. So high levels of cortisol will decrease mitochondrial energy production. It will damage the structure of the mitochondria. It will alter the mitochondrial DNA, and also chronic stress will affect the respiratory chain pathway, particularly complex 4. So this is something that we do know that our children with ASD have an abnormal complex 4 to begin with, and then add on top of this cortisol dysregulation, it's going to just kind of make the mitochondrial dysfunction that much worse. And then blood sugar dysfunction. So cortisol elevated levels can lead to insulin receptor insensitivity, which then will lead to insulin resistance. And as a result, you're going to get increased blood sugar. Some conditions that you'll see with this are Cushing's syndrome, polycystic ovary syndrome, so PCOS, which can be pretty common in our females with ASD, metabolic syndrome, as well as diabetes. And then low cortisol can be associated with hypoglycemia. So what are some of the symptoms for adrenal dysfunction? These are the ones you should be looking out for. So weight gain, abnormal weight gain, sleep disturbances, can't fall asleep at night, wakes up during the middle of the night. Hyperactivity can be a part of adrenal dysfunction, anxiety, cravings, food cravings, specifically salt. Because remember when we go back and I showed you the adrenal gland and how one of the layers secreted aldosterone, that had to deal with salt and blood pressure. So essentially people will crave salt, sugar, there are going to be some dilated pupils, they're going to easily sweat, sensitivity to bright lights and loud noises, issues with blood sugar, so hypoglycemia or insulin resistance, irritability if a meal is skipped, or they're full easily. Aggression, irritability, fatigue, headaches, dizziness, irregular menstrual cycle, brain fog, and cold and heat intolerance. So if your child has experienced any of these, or maybe if you are experiencing any of these, there might be adrenal dysfunction. So some physical exam symptoms. So essentially, when a child comes into the office, part of my routine physical exam will be looking for the pupillary reflex. And essentially what this is that when you shine a light in their eyes, what should happen with that light is that their pupil is going to constrict. But kids who have adrenal dysfunction, it's going to constrict and then quickly dilate again. It's not going to be able to hold that constriction. Also nystagmus. So this is when you're looking at tracing essentially with your finger and you're coming in towards the nose. You can do this with your kids and you'll see the eyes should kind of converge together, but what happens is going to be they're going to kind of do a little bit of a dance and it's not going to be a smooth type of transition. A scalloped tongue. So this is a great scalloped tongue picture that I put up there. Essentially in Chinese medicine, this is indicative of adrenal dysfunction. So this is something easily you can ask your kid to stick out their tongue and look. Or you can look at yours in the mirror. And then striae. These are the stretch marks, so you can see there as well. And there's a few others that I didn't add on to here, but essentially orthostatic hypotension, so quickly standing up and then blood pressure dropping there, dilated pupils you can see on physical exam, and also clamminess, like if your child is a little bit sweaty in their hands or their feet, that can be adrenal dysregulation as well. So how do you go about testing? So cortisol can be tested in 3 different ways. First is saliva, and this is taken at 4 points throughout the day. So usually about 30 minutes within waking up, early afternoon, late afternoon, and then in the evening. So this will allow for us to kind of plot that graph that I originally showed you in the earlier slides. Also, you can do a urine, random urine, but it has to be a 24-hour collection, and this can somewhat be difficult for some of our kids for many reasons. And then also you can do a blood morning cortisol, but essentially this has to be a fasting cortisol and it has to be done right in the morning. And it only gives us that morning cortisol. It doesn't allow for us to see the pattern throughout the rest of the day. So most of the time what I'll do is I'll do a blood morning cortisol fasting as well as having the saliva 4-point cortisol as well and kind of see how those match up. If I just get the blood, what I'm looking for on a fasting AM value is I'm looking for it being in the high range of normal, okay? Even if it's in the normal range, but it's low normal or in the middle normal, that's not good enough for me because that essentially is probably the highest that it is the whole entire day. So I want to see it on the high range of normal. You want to look at liver and kidney function with a CMP, a CBC, vitamin D, a lipid panel, because remember I talked about the cholesterol, looking at all of the thyroid markers, also looking at the thyroid antibodies, I put that up there for the autoimmune component, metabolic markers, so a hemoglobin A1C, a fasting insulin, mitochondrial markers, so these are some of the basics that we look at in the practice, so a total creatine kinase, carnitine, ammonia, acyl carnitine panel, and lactic acid. You can do a hormonal panel if it's indicated, so a testosterone, DHEA, estrogen, progesterone, LH, FSH, and then inflammatory markers, so your CRP and your ESR. So how do you go about treating the adrenals? There are a lot of natural ways to do so, and my favorite are using adaptogens that are herbal compounds. So essentially I listed out some of my favorite ones here. Ashwagandha, we call this in the practice nature's Valium, essentially. So this is a very calming agent. It has an affinity for the thyroid. So if I have a kid that is subclinical hypothyroidism or just some of their thyroid markers are abnormal, I will use ashwagandha to help with that. I also think this is a great mom herb for any of our moms in the practice because it can really help with stress. Then rhodiola, but let me go back on ashwagandha for a second. It is part of the nightshade family, so if your child is sensitive to nightshades, this probably isn't one that you should use. Rhodiola, this can help with fatigue and endurance, situational anxiety, and mental clarity, as well as inflammation. This is one that I tend to use a lot with mitochondrial dysfunction. I find that this complements some of the mito therapies as well. Gotu kola, for ADHD and mental chatter. So if I have a child that's on the hyperactive side and has a diagnosis of ADHD, I will use Gotu kola. Holy basil, this is great for blood sugar regulation and metabolic syndrome. So my kids that have issues with blood sugar, this is definitely one that I'm implementing. Siberian ginseng, this is good for fatigue, concentration, as well as licorice that helps for those low cortisol levels and fatigue. It also has antiviral properties. So if kids are coming in and they have POTS or dysautonomia, chronic fatigue, I usually do a combination of Siberian ginseng and licorice together. Schisandra, this is good for if you have sluggish different types of parts. So essentially lungs, digestion, liver, immune system. This might be a nice one. Astragalus is great for immune system. And then ginseng, there has been a research study done on ginseng with ASD, but this is good for low energy, hypotension, as well as low blood sugar. So these are some of my favorite ones, and they're very effective. And sometimes you don't just do one. You can do a combination of them. And so what else can you do at home? So a whole food, organic, and non-processed diet, grass-fed organic meats with wild-caught fish, increasing your healthy fats, so like your avocados, your oils, your nuts and your seeds, your vegetables, as well as berries, making sure you're avoiding sugar, dairy, gluten, caffeine, and alcohol, and making sure not to skip meals. Definitely increase water intake. So anyone with adrenal dysfunction would really do well on about 60 to 80 ounces of water per day. My recommendation is you should be drinking about half of your body weight in ounces per day. Also increasing your salt intake, again, going back to those adrenals and supporting them. So we have, kind of gotten away from iodized salt, and essentially, because we're all moving towards sea salt, what I think we should do is have more of that iodized salt in there, but the best way to get that is through the pink Himalayan sea salt. I think that one's really helpful, so maybe switching over to that. And then exercising. Exercising, this is an important part of detox, but it has to be to the point of sweating. So the best ones for adrenal dysfunction are going to be your strength training as well as your core exercises. So seated ball exercises, bridges, wall sits, leg rises, and then also stretching. And then, of course, our relaxation techniques. So meditation, mantras, tapping, humming, singing, dancing, all of these can help. And then constitutional homeopathy. So this is where we take a look at your child as a whole, so the emotional, physical components, and then we come up with a remedy that fits their specific picture. Rather than just treating a diagnosis, we treat the person completely, and it's an energetic-based medicine that can be extremely powerful if, given the right remedy. Also making sure that we have good sleep hygiene, so turning off our Wi-Fi at night, blocking the blue light on electronics. So you can do this through your iPhones or your iPads. It's part of the night shift setting. You can turn off the blue light. You can also download certain apps that will do that, or you can get your kids some really cool blue light blocking glasses. Making sure that you're going to sleep in a dark room with cool temperatures, having a consistent bedtime and routine, and not eating right before bed. Also, spend more time outdoors. So we need to get out in nature more. Walk barefoot. This is earthing, essentially, and it can do the mind and the body a lot of good. So just when you get inside, check for ticks. Or you can buy an earthing mat. So next, one of my favorite ones for supporting the adrenal glands is the ion cleanse, which I'm going to talk about more now. So essentially, before I go into this, in the office, we use the ion cleanse a lot, mainly for adrenal dysfunction. So you'll hear the ion cleanse being used a lot for detoxification, but in the office, we've seen this to be significantly helpful for our kids who have some type of adrenal dysregulation. And I just want to share a few stories. So we had one teenager who came in who had been treated in our practice for a long period of time. And he couldn't leave the house without the noise-canceling headphones, right? So he had extreme sensory sensitivities. And he started on the ion cleanse, not by our recommendation. Mom decided to do it on her own. And within 2 months of using that therapy without making any other changes, they were able to go to Disney World without his headphones on, which is amazing. So, that was one big story. Another story that we had in the office was a patient who was also being treated for a lot of years. And, he was pretty verbal. And when he came back to the office, he told my colleague, you've been treating me for X amount of years, 5 years, and this foot bath did more for me in 2 months than you've ever done for me. So, but whatever it is. So, they know that it works and it helps. It really makes a huge difference. And I've really been using it a lot, mainly with my adolescents and my young adults, and seeing great results. So with that being said, we wanted to know why exactly was this helping. So we ran a study in the office looking at cortisol levels in response to the ion cleanse. And it led us to conduct a small study in the office. The sample included 10 children with the diagnosis of ASD between the ages of 6 and 19. Based on who was in the study, they had to have an autism diagnosis and some type of clinical symptoms that were consistent with stress or adrenal dysfunction. So pretty much we could have chosen anyone in the office. But the inclusion criteria, they needed to have at least one symptom, whether that be sleep disturbances, anxiety, sensory overload, hyperactivity, OCD, perseverations, aggression, or self-injurious behavior. We collected cortisol by blood and saliva, and essentially the tests were done 7 days before the intervention of the ion cleanse for a 60-day period, and then 7 days after the trial. In addition to having those levels, we also asked parents to do a symptom form, essentially, where that before we started the treatment, they were able to list 3 to 5 of any symptom they wanted that they were hoping to see improvement in. And then every week they had to report on that same symptom and rate it on a scale from 0 to 12, 0 to 3 being minor, 4 to 8 being moderate, and then 9 to 12 being severe. The foot baths were done on a schedule of 2 days on, 1 day off for a 60-day period of time. And the length of the foot baths were dependent on the child's age. So 25 minutes for anyone between 5 and 8 years old, 20 minutes from 5 to 8, 25 minutes between 9 and 14 years old, and then 30 minutes for anyone above 15 years old. So these were the results for the blood cortisol levels, and about 70% of the children from this results showed that they had improvement in their cortisol levels in regards to blood. So really what I'm looking for here is I want their cortisol levels in the morning to be higher than they were initially before starting treatment. And I hope that kind of makes sense from what I was talking about before. Here's the salivary cortisol results. We didn't really see much change in regards to the AM or the afternoon, but then also looking in the late afternoons, the evening cortisols, what we can see from this is that the cortisol levels decreased after the intervention, which were looking for late afternoon and evening. We want those cortisol levels to be lower in about 60 to 70% of the cases. However, based off of our analysis, the results were not statistically significant, and there was a lot of reasons for this, mainly because of our very small sample size, that it was only 10 children. There was also some flaws in our study design, but there were benefits that were reported on the parent observation sheet. So again, we did see clinical symptoms and clinical improvements, and that's really what we're going by, right? We're treating the child that's in front of us. They are our N of 1. We're not treating so much the lab results that we have in front of us. It's good for a baseline, and it kind of allows for us to make sure we're on track. But if a child's getting better in front of me with an intervention, I'm going to say that it works, even if the cortisol level didn't go down like I expected. A third of the participants purchased the Ion Cleanse unit after the end of the study because they wanted to continue with the treatment based on the benefits that they saw. And our future plans would be to have a phase 2 that would be a larger study, as well as making it a little bit stricter for the inclusion criteria, and also including more markers, so more biochemical, inflammatory, and metabolic markers. So that was our study that we performed in the office. Tyler touched base on some of these previously if you were at the Lunch and Learn, so I'd just like to, recap on those. So essentially this study was done by a mom group that had 27 participants, and over a 4-month period of time, the children used the ion cleanse 3 days on, 1 day off. And what you can see here is that there was a reduction in the ATEC scores, so a 55% reduction. But what I really loved about this study is when they ran it again, what they saw was that there was a 64% reduction for the teenagers. And, this kind of really goes for what I was seeing in my practice too, that it tends to be my young adults who are really benefiting from this. And you can see that through these results as well. Here's the glyphosate study. So we heard a lot about glyphosate this weekend as well. So essentially they measured glyphosate excreted in the urine pre-intervention, post-intervention, and then over a 30-day period of time, there was 10 children in the therapy group that received 12 sessions of the ion cleanse, so 3 per week. And essentially what they saw is post-therapy that there was 48% reduction in glyphosate when there was only a 14% reduction in the controls. Here we look at the autoimmune component of a myasthenia gravis case, and essentially there were 17 participants over a course of 90 days. They had a control group and then a therapy group. The people who were in the control group, they had a 38% reduction in their symptoms, while the control group had a 5% increase in their symptoms. And I think although this is not autism, this does look at an autoimmune disease, and a lot of times we can view autism as an autoimmune disease, and then also with PANS, PANDAS, same thing, that's an autoimmune process as well. So if we have an example of this being helpful for one autoimmune disease, possibly it will be for others. We just don't have some research on that. And this is in the same study where it looked at hospitalizations in regards to myasthenia gravis, and there were 0 hospitalizations for the study participants, but yet there was 10 hospitalizations for those in the control group over a 90-day period. And then this looked at heavy metal excretion. So essentially they had a group that collected their urine for 24 hours over a 5-day period of time, did 1 ion cleanse foot bath for 30 minutes, and then collected their urine for over a 24-hour period of time for 5 days afterwards. What they found was that there was a 34% increase in metal excretion post-therapy. So the best part of the ion cleanse is that there's a 60-day, 100% money-back guarantee. I feel really confident to be able to tell my parents to try this because of that guarantee. There's going to be no questions asked, no forms to fill out, or no restocking fees afterwards. So, I do think that the ion cleanse is really important for any type of protocol. And in the office, we have a motto that is essentially, we should do everything that we can so that in 5 years from now, we have no regrets. And so this is an intervention that we put in that category, that try it for the 60 days, see if this is helpful for your child or not. If it's not, you can, return it. Most likely it will be helpful, but at least we can rule this out and just say that we tried. And so this is my recipe for good adrenal health. Spending time in nature, I would really put that up there. Herbal adaptogens, so those were like the ashwagandha and the rhodiola and the gotu kola that I went over. Constitutional homeopathy, if you haven't tried this with your child, it's one that you should consider. Blocking the blue light, making sure that they're having good quality sleep, increasing your water intake, increasing salt intake, decreasing environmental toxins, making sure that the diet is as clean as it can be, increasing vegetables in any way that you can, and then exercising as well. And these all can make up for a good adrenal health, whether that be for your child or for yourself. So thank you. Great. I have 10 minutes? Okay. All right, I have a question here in regards to cholesterol. How is cholesterol tested and treated if low? So cholesterol is tested by that lipid panel, and it doesn't always have to be a fasting lipid panel now. There's a bunch of research that it doesn't have to be fasting. So essentially I'm looking for that total cholesterol level, and I want it to be 160 or above. I see a lot of my kids under that 120 range, and to me that's way too low. So how I go about treating that is essentially I say an egg yolk a day. Okay, so hopefully there's no egg allergy. If there is an egg allergy, I will also say increasing essential fatty acids, and I think that essential fatty acids are usually underdosed. So and to be in therapeutic range, you really have to be to 3 to 6 grams. Sometimes I'll push that even more up until what they can tolerate, essentially until there's oil in the stool or easy bruisability or some nosebleeds. So, fish oil as well as dietary changes with increasing good healthy fats, but also putting in that egg yolk per day. Is red face, red ears, hot skin to touch possibly a cortisol issue or something else? So this I would be looking for salicylates, essentially to see if you have a phenol sensitivity. That's usually what you see is after eating. The face will get flushed, the ears will get flushed, so I would rule that out. Best forms of good cholesterol, I think I went over that already. So can fasting help with blood sugar issues and adrenals? Yes, it can. So my recommendation would just make sure that you're under the guidance of a practitioner with fasting, just to make sure that you're doing it correctly. Usually I think it's pretty good to, again, it should be individualized. You have to be with a practitioner that knows exactly the case, make sure there's no underlying issues, rule out all the other issues with metabolic syndrome before you start fasting. How much spit has to be collected for the cortisol testing? Awesome question. So it depends on the lab that you're going to. There is one lab, the only one we use in the office, has a pediatric kit essentially, and it looks like a long Q-tip, and it's made of cotton, and you kind of put it in their mouth, but it's big enough so you're holding on to it so they can't choke. And you just keep it in their mouth if they'll allow you for about, they say 60 seconds, but let's be honest, usually we can't keep that in there for 60 seconds. So just until it's fully saturated, and then they have a whole contraption essentially that allows for you to collect the saliva that way. And so I think that's much easier than having a child spit into a container. I don't know if anyone's done that 23andMe, but I think an adult can still have an issue trying to spit into those and getting enough saliva. So definitely ask your doctor to have like the pediatric kit to help with that. What time of day is best to use the ion cleanse for adrenal fatigue? It really depends. I would probably say if you had low adrenal function, I would most likely recommend using it in the morning. However, that's not going to be ideal for everyone's work schedule, school schedule. So really how we think it's working is helping to kind of reestablish it and putting it back into normal rhythm. So it really can be used at any time of day. You just have to see how your child responds. Make sure that there's no, die-off type of situations that might change when you're going to administer it and for how long you're going to do that for, or how long you'll do the intervention for. Okay, great. What should you do for a child, young adult who does not sweat ever, regardless of exercise heat? So this is somebody who definitely needs support and has adrenal dysregulation. So what I usually say for these people is, I know you put heat here, but I would do sauna therapy. So essentially there's a whole protocol that you go in at a certain temperature for a certain amount of time up until the point that they start to sweat. And then from there, you'll increase the time and you'll increase the temperature. But sauna therapy can be really helpful for getting that moving. How long for kids younger than 5, 3.5 years old? So, this you should talk to the company about. I have my views. I think, I usually start at 5 minutes for the young kids and then increase in increments of 5 minutes weekly, depending on how they respond. I think they're going to recommend about 15 minutes. So, but I tend to go a little bit shorter at 5 minutes. what supplements would you recommend other than the adrenal cortex to help with adrenal function? So the supplements are all the ones that I talked about in regards to the adaptogens, the herbal adaptogens. I really think they can significantly make an impact. So trying those out, again, if you try one and it wasn't great, try another or try them in combination. But my go-to is usually the ashwagandha first, then rhodiola, and then I'll do more specific combinations depending if I need to. Okay, I think that was all of them. Yeah.